Hi, myself Dr. Angela Aishwarya from the Department of Anesthesiology, Narayana Medical College, Nellore. Before the use of first general anesthesia in mid-19th century, surgery was undertaken only as a last resort, with several patients opting for death rather than enduring the excruciating pain. Like how we all have gathered now to commemorate this day and celebrate precisely the same way people would have gathered in the operating theatres. Let me remind you not to cheer up, but to listen to people scream and to witness the scenes in action when a hand or leg is amputated of a gangrenous patient. From that age of black fear, here I am today, a would-be anesthesiologist, to present with you all the good facts and to make us realize the importance of this wonderful day and to feel proud as to why we are called magicians of life, saviors of the body. The first World Anesthesia Day was held on 16th October 1903 to mark the anniversary of first successful application of anesthesia on 16th October 1846. On this day, American physician and dentist W.T.G. Morgan used diethyl ether anesthesia at Massachusetts General Hospital, Boston, on a patient who has to undergo removal of a jaw tumor, and he underwent the surgery without any pain or consciousness. And this was performed on a surgical amphitheater which is known as the Ether Dome, and it is preserved as a monument till date. This ranks as most significant events in the history of medicine and began to be celebrated as World Anesthesia Day globally. Thereafter, physician and writer Oliver Wendell Holmes proposed the name anesthesia. James Young Simpson used chloroform as general anesthetic for the first time in the year 1847. And John Snow, a leader in the development of anesthesia, invented chloroform inhalers, ethyl inhalers, and he administered chloroform as anesthetic for Queen Victoria for her deliveries. Sir Evan Magel's contribution to anesthesia are innumerable, like introduction of endotracheal intubation, ET tubes, blockers, circuits, and many more. Anesthesia enables the painless performance of procedures in a patient that would otherwise cause intolerable pain who are not anesthetized. The evolution of anesthesia is quite remarkable. From the ages of crude techniques like knockout blows on head, ingestion of ethanol and herbal medicines, inhalation of gases like chloroform and ether, local anesthesia, spinal anesthesia, muscle relaxation, general anesthesia, epidural anesthesia for prolonged surgeries and for post-operative pain management, and labor epidural for painless labor have evolved. We anesthesiologists can now render just a part of the body numb, and which will enable the surgeons to perform surgeries without making the patient lose all consciousness. And this was made possible with the advent of regional nerve blocks. We have advances in all directions like newer inhalational agents, target control infusions, bispectral index, fiber optics, monitors, workstations, nerve stimulators, robotic anesthesia, and now the drive is towards nanotechnology. Pain and palliative care is another upcoming super specialty in anesthesia where we focus on ultrasound guided peripheral nerve blocks. The introduction of ultrasound has revolutionized the day-to-day practice of anesthesia for the past 20 years. It is like an eye of an anesthetist for peripheral nerve blocks, neuraxial blockade, and airway assessment. In this way, the kingdom of anesthesia has witnessed tremendous development since infancy, and now the administration of anesthesia has become much easier. Just a simple jab and the job is done. Today, this event is organized by World Federation Society of Anesthesiologists with over 134 societies representing anesthesiologists from over 150 countries taking part in it. And finally, after 175 years of successful public demonstration of anesthesia, we have entered into a more challenging phase of humanity. Being the forefronts in treating the patients with COVID-19, our specialty has never felt such challenges. And I would like to conclude with this. We anesthesiologists are the risk sink, an analogy to the heat sink of a computer. We are the first ones to be questioned for everything that goes wrong with the patient. A heat sink in a computer may not seem to be doing much, but without which the whole system overheats and collapses. Patients may not recognize us, but we are the ones who keep them safe. We are the heat sink. Unlike other departments, we all are cut from a different cloth. Because when it comes to putting anyone, right from the commoner to the queen, at ease without pain during a procedure, we use best of our knowledge to make them pain-free. Today, the entire world is thankful, and I'm so proud to be gifted by God, and so should all of you. So this 16th of October, let us acknowledge the greatness of anesthesia and celebrate anesthesiologists, who are also known as the perioperative physicians. Happy World Anesthesia Day. Safe anesthesia, safe surgery, safe patients. Thank you.